Ondansetron, which is commonly known by its brand name Zofran, is a drug that eliminates nausea and vomiting. This discovery was a breakthrough for pregnant women, patients immediately after surgery, and patients receiving chemotherapy. Women who are pregnant often experience nausea, which leads to vomiting. This is commonly known as morning sickness. Pregnancy can cause the mother's hormones to be imbalanced, which means the stomach can produce excess serotonin, which triggers nausea. So what causes nausea? There are many biological pathways, but we will focus on 5-HT3 receptors because Zofran inhibits this receptor specifically. Excess serotonin in the small intestine can cause nausea. In response to chemotherapeutic agents and other irritants, enterochromaffin cells in the small intestine release serotonin, which stimulates vagal afferents via 5-HT3 receptors, which initiates nausea and ultimately vomiting. Zofran prevents this biological process by competitively inhibiting the 5-HT3 receptor before the serotonin can bind to it. As a result, the vagus nerve is not irritated, which stops nausea and vomiting. Serotonin works in the same way as a car going to a parking spot. Seth is just like a serotonin molecule. He wants to park his car like the serotonin wants to get to a receptor and bind. Problem arises when Seth tries to park his car and his spot is taken, just like Zofran binds to the receptor before serotonin can. The silver car and Zofran are inhibitors by taking another spot.
What is solubility? Solubility is the ability for a given substance, the solute, to dissolve in a solvent. Orally administered drugs need to be highly soluble in water so that they can readily be absorbed into the body. Solubility of a drug determines the administered concentration and the anticipated pharmacological response.
There are many forms of administration, but the sublingual route is the most used since it requires no chewing or swallowing, which is ideal for individuals who can't keep anything down. It is placed under the tongue, dissolves, and goes directly to the bloodstream via the veins underneath the tongue.
Zofran follows all of Lipinski's rules, which is crucial because it is a checklist to see if a drug would be orally active. These rules are related to solubility, hydrogen bonds, and molecular weight. Zofran has a log P of 2.4, which is very good because it means it is hydrophobic enough to go through the cell membrane and hydrophilic enough to dissolve in our blood.
In order to increase solubility, processes that increase the amount of pores in the tablet are used. This is because it allows saliva to penetrate the pores and dissolve the tablet more quickly. The process is as follows. First, microcrystalline cellulose and sucrose is added to make ondansetron water soluble. Then, bulking agents and acidic material is added to increase the ability to break down in solution. Afterwards, the drug has all the water from it removed to make a hard solid. Then polyethylene glycol is added to make the solid softer to form tablets. Then a volatile salt is added to create pores in the tablet to increase solubility.
Ondansetron has many positive impacts on society. It has led to millions in savings of healthcare dollars by allowing surgery and chemotherapy patients to go home instead of paying to stay in the hospital. It also leads to a better quality of life because it allows people to have comfort in difficult situations. Elderly individuals and children mortality rates have significantly decreased by taking Zofran since they are the people that have the hardest time with vomiting. Vomiting leads to dehydration, which can lead to death. By having Zofran in a dissolvable pill form that does not need water or chewing action, it helps individuals be able to keep fluids down and feel better by blocking the extra serotonin. In the end, Zofran has changed millions of lives and continues to do so every day. Without Zofran, the medicine world for chemo patients, surgery patients, and pregnant individuals would be a lot harder.
Yay!